If you've tried everything, rest, physical therapy, injections, and your foot still hurts, you're not alone. The good news, there's a next step, combining two powerful regenerative treatments, shockwave therapy and PRP. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. After treating thousands of patients with stubborn foot pain, I've discovered that combining these two treatments creates a powerful healing environment that neither can achieve alone. In today's video, I'm going to explain how this combination works, which foot conditions respond best, and what you can expect if you're considering this treatment. Most people with chronic foot pain have tried everything: anti-inflammatory, stretching, physical therapy, even cortisone injections. But when these conventional treatments fail, many assume surgery is the only option. What they don't realize is there's an effective alternative that can help them avoid surgery altogether. The combination of shockwave therapy and PRP injections have revolutionized how we treat persistent foot pain. These two treatments work in completely different ways, but when used together, they create a synergistic effect that can jumpstart your body's natural healing process. If you're finding this information helpful so far, please take a moment to hit the like button. This helps others with chronic foot pain find this crucial information. First, what exactly is shockwave therapy? Despite its intimidating name, it's actually a non-invasive treatment that uses acoustic pressure waves, not electric shocks, to stimulate healing. These pressure waves are delivered through a handheld device that's placed against the skin in the painful areas. When these waves penetrate your tissue, they create controlled microtrauma. Now, this might sound counterintuitive. Why would we want to cause more trauma to an already painful area? The answer lies in how your body responds to this microtrauma. The pressure waves stimulate increased blood flow to the area, which brings oxygen and nutrients essential for healing. They also break up calcifications in scar tissue that might be impeding recovery. Perhaps most importantly, they trigger the release of growth factors and stem cells, your body's natural healing agents. Think of shockwave therapy like aerating a lawn. By creating small channels in compacted soil, you allow water, air, nutrients to penetrate more deeply, resulting in healthier growth. Similarly, shockwave therapy creates pathways for healing factors to reach damaged tissue. Now, what about PRP? Platelet-rich plasma therapy uses your body's own healing factors to accelerate recovery. Here's how it works. We draw a small amount of your blood, similar to a routine blood test. This blood is then placed in a centrifuge, which spins at a high speed to separate the different components of the blood. What we're after is the plasma that's rich in platelets. Platelets contain growth factors, specialized protein that signal your body send healing cells to an injured area. By concentrating these platelets and injecting them precisely where they're needed, we can deliver a powerful healing boost directly to the damaged tissue. If you know someone struggling with chronic foot pain that won't respond to conventional treatments, please share this video with them. This information can help them find relief where nothing else has worked. So why combine these two treatments? The answer lies in their complementary mechanisms. PRP provides the ingredients for healing, the growth factors and signaling proteins that tell your body to repair damaged tissue. Shockwave therapy activates and stimulates these ingredients, creating an ideal environment for them to work effectively. It's like planting seeds in a garden. PRP provides the seeds, while shockwave therapy prepares the soil and creates optimal growth conditions. Together, they create a powerful healing environment that can succeed where other treatments have failed. The timing of these treatments is crucial for maximum effectiveness. Typically, we perform the PRP treatment first, delivering these concentrated healing factors directly to the damaged tissue. Then within a few days, we begin a series of shockwave treatments, usually once a week for 3 weeks. This sequence allows us to first introduce the healing factors and then repeatedly stimulate them with shockwave therapy, maximizing their effectiveness over time. The result is a comprehensive approach that addresses both the need for healing factors and the environment in which they work. If you're finding this information valuable, please hit the subscribe button and notification bell. I post new videos every week with crucial information about foot health and advanced treatment options. Which foot conditions respond best to this combination therapy? While results can vary from person to person, we've seen remarkable success with several common conditions. Plantar fasciitis is perhaps the most responsive condition, especially chronic cases that haven't improved with conventional treatments. The combination of PRP and shockwave therapy can be particularly effective for patients who've been suffering for months or even years with persistent heel pain. Achilles tendinopathy is another condition that responds exceptionally well to this combined approach. Whether the pain is at the insertion point, where the tendon attaches to the heel bone, or higher up in the tendon itself, the combination of PRP and shockwave can stimulate healing in this notoriously difficult to treat area. Peroneal tendonitis, which causes pain along the outside of the ankle and foot, also responds well to this combination therapy. This condition often becomes chronic because of the tendons in this area receive relatively poor blood supply, making the increased circulation from these treatments particularly beneficial. Stress injuries to the bone, sometimes called stress reactions or early stress fractures, can also benefit from this approach. The combination therapy can stimulate bone healing and prevent progression to a complete stress fracture, potentially avoiding weeks in a walking boot or cast. What can you expect during treatment? The PRP procedure begins with a blood draw, typically from your arm. When the blood is being processed in the centrifuge, we prepare the injection site. Depending on the area being treated, we may use ultrasound guidance to ensure precise placement of the PRP. The injection itself only takes a few minutes. Some patients experience mild discomfort during the injection, but this typically resolves quickly after. After the injection, you may notice some soreness in the area for a day or two, which is completely normal. Shockwave therapy sessions usually last about 10 to 15 minutes. During treatment, you'll feel a tapping sensation as the pressure waves are delivered to the target area. The intensity can be adjusted for your comfort, though some mild discomfort is normal and actually indicates we're treating the right spot. After each shockwave session, you might experience some redness or soreness in the treated area. This typically resolves within 24 hours and is actually a sign that treatment is stimulating the desired healing response. One of the major advantages of this combination therapy is that there's minimal downtime. Unlike surgery, which can require weeks or months of recovery, most patients can continue their daily activities throughout treatment. We typically recommend avoiding high-impact exercise for a few days after PRP injections, but walking and normal activity are usually fine. Results aren't immediate, and this is important to understand. Unlike cortisone injections, which often provides rapid but temporary relief, regenerative treatments like PRP and shockwave therapy work by stimulating your body's natural healing processes. This takes time. Most patients begin to notice improvement within 2 to 4 weeks of starting treatment, with continued improvement over the following months. The full benefit might not be apparent until 3 to 6 months after treatment, but the results tend to be more lasting than those from cortisone and temporary measures. What about insurance coverage? This is also an important practical consideration. Currently, most insurance plans, including Medicare, don't cover PRP or shockwave therapy. These are considered cash pay procedures, though some flexible spending accounts or health saving accounts may cover them. While out-of-pocket costs might seem significant initially, many patients find it's actually more cost-effective in the long run compared to continued copays for physical therapy, repeated cortisone injections, or much higher costs associated with surgery and post-surgical rehabilitation. Who's an ideal candidate for this combination therapy? Generally, patients who have been in pain for at least 3 to 6 months and haven't responded adequately to conventional treatments are good candidates. This includes people who want to avoid surgery or those who aren't good surgical candidates due to other health conditions. Athletes and active individuals often choose these options because it allows them to maintain their activity level during treatment and potentially return to sport faster than they would after surgery. The regenerative nature of these treatments means the healed tissue is often stronger and more resilient than after conventional treatments. If you're dealing with chronic foot or ankle pain that hasn't responded to standard treatments, schedule an appointment for an evaluation. We can determine if you're a good candidate for this combination therapy and develop a treatment plan tailored to your specific condition. The link to schedule is in the description below. Please take a moment to like this video and share it on social media. Your simple share can help someone find relief from chronic foot pain that they thought they'd have to live with. Also, leave a comment below if you have questions about shockwave therapy, PRP, or other regenerative treatments. I do my best to respond. Thanks so much for watching, and have a great day.